acute and chronic knee pain. These are separate entities, and usually there's a different history surrounding the starting of this pain. So acute pain typically lasts 6 to 12 weeks or less. Chronic pain is considered an injury or something that is going on for 12 weeks or greater. We often see acute pain in the knee during some sort of inciting event, such as a fall, a sports injury, something that damages the tissue or injures the knee. Perhaps you strain the knee, meaning you overstretch some of the tendon and ligament attachments. In more serious acute injuries, you may have a rupture of your ACL, or your meniscus might be damaged, and sometimes those can last a bit longer. So when you've injured your knee acutely, sometimes you'll see, in addition to the pain, redness, swelling of the knee. If it's a severe injury, there could be blood within the knee, and that won't be identified until we stick a needle in there to drain the fluid. And when we get back blood, then we know it's something that's a little bit more urgent and would likely send you to one of our colleagues in orthopedic surgery. Most of the time, an acute knee injury is a simple strain, sprain, and we often recommend an initial period of rest. Ice can be helpful. Often talk about elevating it, maybe above the level of the heart while you're lying on the couch, and give it time. Time will heal it, but if it gets prolonged in nature, again, after 4 to 6 weeks, if not getting any better, or perhaps it's starting to get worse, further evaluation would be recommended with an x-ray and a physical exam. Treatment for an acute injury is typically anti-inflammatories or other non-narcotic pain medications, along with rest, ice, and anything else that makes it feel better. But mainly just remaining off of it, avoiding any activities such as sports that might injure it, and give it time to heal. Chronic pain of the knee is something that's typically gone on more than 12 weeks. Now this can be a severe injury that's been prolonged, but oftentimes what we see is chronic pain related to knee arthritis. Arthritis in the knee is when the joint itself becomes damaged, or over time the cartilage in the knee begins to wear away. When this happens, your body, instead of acute inflammation, which is often a beneficial response for the body to heal damage, the body begins that process of chronic inflammation. And this is a very inefficient way that the body tries to deal with tissue damage. And in this instance, we have some other therapies that we try to combat the chronic inflammation. One of the first therapies that people often will get is a cortisone injection, or some steroids injected into the knee joint itself. This is great for decreasing acute, but primarily chronic inflammation, and decreasing that prolonged inflammatory response. Oftentimes, here at Carolina's Pain Center, we'll have patients who have already received maybe 1, 2, or even 3 steroid injections before getting to us, but they still have pain. And the steroid injection might only last for a month or 2 months. In that case, when we see evidence of arthritis on the x-ray, there's another injection we can do for this therapy, and this is called viscosupplementation. This is a type of hyaluronic acid, and acid sounds scary and bad, but in this instance, all it is a large molecule that helps retain moisture within the knee joint. Depending on the manufacturer of the hyaluronic acid, the injection is spaced either 1, 2, 3, or even every week up to a series of 5 injections total. About a month after the last injection is when we hope to see improved results. Now, the viscosupplementation will not regrow cartilage, but what it does is it helps nourish the knee itself, provides a better environment for the knee to help hold on to any cartilage that you may have, and again, increase the viscosity within the knee. Over time, viscosupplementation can be repeated, but it will also start to no longer be as effective, and you may only get 4 months of relief. If you get less than 6 months of relief with the viscosupplementation, then it may be time to consider yet another alternative that we can offer here at CPC, and that's a nerve block. There are 3 primary nerves that tell you you have pain in your knee. They are here, here, and here. I don't know if that's going to work. Those are the primary nerves that tell you have pain in your knee. What we can do here under x-ray guidance is identify where those nerves should be, even though we can't see the nerves, but based on the bony anatomy, we know where to typically find them. We'll use a very small amount of numbing medicine, bupivacaine, to turn those nerves off temporarily. What we hope is that for even just a day, you notice a large improvement in your pain relief and functionality. If you come back and say, hey, listen, it didn't last long, but for at least a day, it felt great. I had at least 50% reduction in symptoms, then we know that that could be a big portion of your contributing pain. We'll do the injection one more time just to confirm the location of the nerves and your response. If on 2 separate occasions you have pain, we take it away, it comes back and we take it away once again, you may be a good candidate for a more advanced procedure called radiofrequency ablation. This is the same procedure as the nerve block, but a different needle. This needle has a probe on the end of it. And unlike the test injection where we use bupivacaine to temporarily turn off the nerve, this creates a scar on the nerve, essentially. It burns the nerve, as you may hear. And this is more of a mechanical blockage so that nerve impulse can't be transmitted to the brain and you therefore feel less pain. Unlike the test injection that might not last long, this should hopefully last anywhere from 9 to 18 months on average. We have some patients that might need to repeat the burning of the nerve once a year, or others have to do it maybe every other year. It's a very individualized response. But this can be a long-term and effective strategy for people who either don't want to have a knee replacement or need a knee replacement, they just want to kick that can down the road a little bit. So whatever the reason for it, we'd be happy to evaluate you and see if you'd be a candidate for one of these several knee procedures that we offer here at CPC.